like, so what would, in a nutshell, what would you say? Are there roles in PCNs for non-pharmacist prescribers? And what do they look like versus what does the role for a pharmacist prescriber look like? Could you just give us a little
Yeah, so the thing
overview?
is that even before I became a prescriber, I was still working almost like a prescriber. So the thing
Okay.
is that the only difference is if you're not prescribing, you don't have that final sign off on your own decision. So if I'm changing someone's medication, if I'm amending something, if I'm stopping something, anything I do, any decisions I make, I'm then going to the doctor and going, oh, listen, I want to do this. I want to do this. You have to basically have like a debrief type thing,
Mhm.
right? Um, and sometimes it's easy. If someone's got hypertension, they've got this. They just need a dose increased. Someone's on concodamol, they need a higher dose. Someone's, anything like that. But it's even the basic things. And the patient sat in front of you, like, okay, go sit in the waiting room. And then you're stood outside the doctor's room trying to listen
Right.
in to think, is that a patient in there? Is he on the phone? And sometimes you knock and you don't hear anything back. Sometimes you knock and they go, come in. And you go in and there's a patient sitting there. I'm like, oh, I'll come back. And they go, no, don't worry about it. Come in. What's up? What do you need? And I was like, I need to debrief with you about this patient. Yeah, go on. And I'm like, but there's someone sitting there. They're like, yeah, that's fine. Don't worry. Just tell me what you want to. And, and then they'll just look at it and sign it and go, yeah, it's fine. Um, and I think I built that relationship and that trust with them to the point where
Mhm.
sometimes I'd go in, they won't even look at what they're signing. They just sign it. And, they'd be talking to me about the football or what was on telly last night. And I'm like, oh, do you want to know about? No, it's fine. I trust you. Okay.
Yeah.
And then, they build that thing that who knows more about the medicines than the pharmacist. It's like if it's a medicine issue, they'll be asking me things rather than me going to debrief. And that's where it's got to now. But they'll
Yeah.
call me and go, oh, what can I get for this? What can I get for that? Is this safe for this interaction? Or what about this or what about that? And they just leave it with me now.
That's amazing. And so, like, just taking do you know what, Avid, your career journey is just epic because a lot of people feel that, if they go into community, if they go into and they stay there for years and years, they haven't really learned anything or done much with their time. But actually, from your career trajectory, you can see how every single interaction with every single job role you've had has had a profound impact to where you've got to now, whether it's learning how to build relationships or be able to navigate different things between the area manager and, like that power play between someone above you, but also you're the clinician. And then you've taken those to like the next step where you work well and then learn all this HR stuff, which you definitely need for the role now to be able to manage teams. And honestly, this is just so cool. This is just, honestly, it's epic. So I was going to ask, so now you're the lead of a lot of different healthcare professionals. Um, how did you have to learn what the different roles do? Did you know already? Like, how did you kind of, go to that bit after this?
So that was probably, I'm still learning, to be fair. I've been in this job now for, I think, 3 years as the team leader. And even now, like, what everyone does, I wouldn't say I know 100%. I know their jobs, I know their job roles, I know the gist of what they can do and can't do. I know, when we have these discussions, they talk about things that they might find difficult or things that they might need to kind of refer often back to primary care or back to the GP. Say, for example, the paramedics, right? I'm like, right, I've now got a team of 3 paramedics that I'm looking after, 4 paramedics. What does a paramedic do? My experience with paramedics working in as a, it's not even healthcare based. My experience with paramedics is just the ones that you call if there's an accident or something like that.
Right.
So that's gone from all of a sudden going paramedics. So if you're having a heart attack, if someone's in a road traffic accident, to now we've got a paramedic home visiting team. So what they do, we call them emergency care practitioners. So they go out and do the visits on behalf of the doctors. The doctors will still go out and see those patients that need doctors' input, but those that don't, the ECPs will go and see the paramedics.
Amazing.
Yeah. So
Yeah,
yeah,
I didn't
yeah,
know.
yeah. And this is the thing is the thing with the R's roles, or the in the PCN, the funding comes from something called additional roles reimbursement scheme, which is shortened to R's. So those R's roles, once you've got them in, you can kind of do what you want with them, which can be great because you can develop massively. You can see patients that you never thought in a million years you'd be seeing, and you become competent in things that you never thought you'd be able to deal with. But at the same time, sometimes you just get brought in because there's money here. And you've got examples of pharmacists working as prescription clerks, just processing prescription scripts all day. And it's like that's not what we're there for. There's no clinical, you're not using any clinical judgment. You're not having any
Yeah.
clinical output. You're just another cog in the machine. And that can be quite frustrating. But it depends on the individual. Some people just think I've got a cushy here. I'm getting paid to do something that's kind of well below my pay grade. I'm just going to stay here.
Yeah.
I'm the opposite. I'm the opposite. I'm too kind of driven. I get bored too quickly to be doing boring work.
Yeah.
Yeah, wow.
Another question I was going to ask, actually. So you obviously, earlier in the podcast, we discussed about that, your time at Moorgate, and then you saw that lady that had seizure, and there's lots of people working in the city and not many GP practices, and they can't take time off work. And now that you're in this role where you're kind of effectively managing consultations, booking people in for appointments and things like that, and obviously there are people that work outside of 9 to 5, that work within 9 to 5 and can't see appointments. How do you see us getting to a point where people can access appointments where they don't have to take time off work? Or, how do you see that kind of happening?
So obviously you've got kind of out of hours services that are available, and the kind of, I think last year or 2 years ago, there was the enhanced access basically that the government kind of decided to force upon primary care, where they were like, you've got to offer a certain amount of appointments or time in clinic available for patients outside of your standard core hours. So actually, whether that's weekends, whether that's after in the evenings or first thing in the morning, so people that do go to work do have access to these additional appointments, basically. So it's not something that I tend to manage. I think the government's thought about it, but the problem was that you're not bringing additional staff. You're using the same staff you've got
Right.
to deliver more hours, which leads to more and more burnout, which leads to
Exactly.
more and more stress. Yeah, and I look around and I can see burnout in most of the GPs that I work with, most of the nurses, most of the receptionists get the hardest part of it.
They do.
Yes, they're not making decisions in terms of life or death, but the abuse they get, the decisions that they have to make to kind of say, I'll try and speak to the doctor for you, or you need to come in back and speak to someone tomorrow. Even that there's a burden on that decision you're
Yeah.
making, because especially when you haven't got the clinical knowledge, you don't know if that decision you're making is going to have, a serious impact on that person's health over the next 24 hours.
Yeah. It's so
Um,
true.
and it is hard. It
Always
is
the
hard.
people at the front door get it the worst, right?
Yeah. Yeah.
I think maybe a conversation for another time would be interesting to explore whether, would you trust a machine to triage, or would you trust a receptionist? Like which one would be better? Because if it was like an AI, then, they don't care if they get the abuse shouted at them, because they're just a
It's
machine,
true.
right?
Yeah.
It's true. But at the same time, you lose that human element,
Right.
because there's, even when you practice, medicine, or you see patients, you have consultations, there's that thing, it's actually there when you're practicing, where you talk about gut feeling, right?
Mhm.
And you trust your gut feeling. a machine doesn't have gut feeling. Someone might present and all their sats be, all their obs be kind of okay, but you look at them and you go, there's something not right here, right?
That's such a good point.
The machine would look at it and go, your obs are fine, go home. Whereas the person would look at it and go, this person's very frail, they're sweating profusely. Yes, their blood pressure's okay, their sugars are normal, their O2's okay, they're not dying right now. But in reality, they might be having a silent MI. They might be having something that you won't be able to pick up unless you use like critical thinking or you use your gut feeling as a human being. I think you talk about AI and there is massive scope for it. It does not scare me, but it scares me a little bit, but also fills me with hope in terms of what it could be used for. But obviously, we're miles away from using that at the point of interface that in the GP surgery.
Yeah, I think that's such a good point about gut feeling, because I think that's kind of lost, definitely. When things like ChatGPT and stuff feel and seem so familiar in the way that they're talking, but you're right, it lacks that human. But also, I can't believe we've just been chatting for so long, but we've got one more thing to really focus on, which we know that the government set out the scheme for pharmacies to be able to support with prescribing on 7 disease areas, where patients can now access treatment through their pharmacy. So you developed a training company, right? Do you want to tell us a
Yeah,
little bit about that, like kind of how it came about, and where'd you get the time and the energy, basically?
so it came about in, I think, January. I've got a friend who's a pharmacist who's always kind of looking to make the next, let's say, quick buck, right? And he saw it and he was like, this is an opportunity. And he called me and he said, look, do you want to set something up? Like clinically, you know what you're talking about, in terms of examinations and training. And this is what we could be setting up. So there's the three of us, me and 2 other pharmacists, we got together and we went, right, we could deliver this. And I said from day one, I was like, mate, I could deliver the training. It's not a problem. I deliver training all the time in the PCN to the other pharmacists, the paramedics, occasionally doctors and stuff like that. It's not hard. And as you can tell, I'm more than comfortable just talking, right? Which is an indication of how long this recording has already gone on for. Yeah. But they said that right, we'll try and have a slightly different. I think there was 1 or 2 companies already out there that were doing it, but we wanted to be slightly different in terms of the fact that a lot of these guys would just come to our training. You'll see how to do it. And that's it. We had that thing was actually get hands-on training involved, because as he has mentioned, there's 7 different conditions that the pharmacy first can treat for. 5 of them are basically just PGD based, where you're just asking questions. You're not putting hands on a patient, you're not assessing them, not examining them. The 2 of them which you are slightly doing that is the sore throat, PGD, the acute sore throat, and the otitis media, or the ear infection. Now, acute sore throat, we do the training as part of that. So those are 2 conditions we do the training on. So examining and assessing someone's ear, as a pharmacist working community pharmacy, no idea how to do that. All right, I had no idea how to do that until I came into the PCN and I did the assessment course. I have no idea how to use an otoscope. How the hell do I hold one? Right, and I've got one here. Well, I was supposed to have one here, but I haven't got my bag with me. But for example, we thought we'll get a doctor to deliver the course, because pharmacists will take it probably a bit more kind of to heart if it's a doctor delivering it, right? Plus, just for our own kind of peace of mind, it's like, right, we get an experienced GP and who's going to have answers to all the questions. And they can leave the rest of us to focus on everything else that needs to be done on the day. So we got together. We thought, right, 3 or 4 sessions we'll put on, 3 or 4 days we'll put on, and each day we'll have 2 or 3 sessions, 2 hours each. We, we found a doctor that would do the training. We found venues. I ordered all the consumables. We, constant emails, the socials. Oh my God, social media to try and listen. I was on Instagram, but I never really used it. It was just there, right? Now I'm on Instagram. I'm trying to figure out how do I upload something on Instagram? How do I set up this account? And I'm like, my wife's there, and she's like, "It just, hey, I'll show you, right?" I was like, Sadia, how do I comment on something? And she's like, "You just do this." Okay, thanks. I want to upload a story, but how do I put like a link on there? I was like, I put the link, but no one can tap on it. Like I know how to put writing on the thing. And she goes, no, that's not how it works. I was like, mate, can you show me? And then there's times where she's not there, so I'm Googling it, like how to add link to Instagram story. um, so yeah, so I've got the pharmacy first thing set up, just trying to just engage with lots of people, putting regular posts up, just try and basically promote our service. And we had 3 days initially set up, one in Hertfordshire, one in Cambridge, one in Kent, just because we were like, right, where is there no training available? Or where has the LPC not organised the training? So we did that. We promoted it online. We promoted it in local WhatsApp groups. Promoted it through social media. Different forms of promotion. And some people. There's a popular Instagram group or account called, I think it's called Pharmacist Pay or Locum Pay.
Oh yeah.
Yeah. So look, we've booked the venues. All this is money out of our own pockets, right? We've booked the venues. We've hired the trainer. We've done everything, all coming out of our pockets. We've been selling tickets, and we've sold a decent amount of tickets, enough to cover the cost and maybe a little bit. But then I think a week or 2 before our first event, and bearing in mind this has all been done in a week or 2. This whole company's been set up, everything's been set up, the social media, the venues, everything's been set up in like a week or 2. And you said, where did you find the time to do it? I was actually on annual leave at the time. It just coincided that I was on annual leave.
There you
And I
go.
was sitting there, I was writing, designing the website, writing the agendas for the actual meetings, writing the emails to kind of setting the templates, sending out communications to everyone, responding to all the messages online, trying to engage with people online. And literally that week that I was off, I was just on my phone or on my laptop the whole time, just trying to sort this stuff out. Now, obviously, we've gained a bit of traction. We're selling a few tickets. We're reaching out to other kind of pharmacists that are online, like influencer pharmacists, to kind of say, right, you have a training platform here. Would you be willing to promote it, or would you do this, or would you do that? And they're like, oh, we want £20 of each ticket sold. I was like, each ticket, we're trying to market as a fair price. We're not charging £90, £100 like some other people. We're only charging £50. Like you want £20 out of a £30, £50 ticket. That leaves me with very little to actually play with, right?
That's a bit
But
extortionate,
Yeah.
to be honest.
but people will try and take advantage. Well, look, I have got no experience in the social media game, as probably realised. But trying to talk to these guys and going, right, like, can you support? And some of them just shared it, like, on their story, just because you have that conversation. It's like, yeah, fine, I'll share it, no problem. And some of them obviously just try and take advantage of the situation. Now, so we're getting a bit of traction. We're selling tickets. It's getting closer to the day, and then all of a sudden we start getting 2, 3, 4 emails asking for refunds of their tickets. And I'm like, what the hell's going on here, right? And then one of my mates that was in this other WhatsApp group messages me, and he said, "Oh, just to let you know, man, someone shared this screenshot in the WhatsApp group, and the screenshot is a Instagram story from that locum pay group saying, be careful of fraudulent companies like Pharmacy First Training, who are only going to take your money."
What?
So I'm like, what the hell is this, right? So I've tried to message this person on Instagram a few times. They never replied. Whether they were affiliated with any of the other companies that offer the training, I don't know.
That's
Because
awful.
there's no face to the account, I have no idea who's done it. And they never responded, so it is what it is. So then we're just doing not damage limitation, but we're calling every single person that's asking for a refund. Or I called most of them, just kind of go, right, what's the issue? I messaged the person initially that shared that screenshot in the group to say, why are you spreading this information?
Mm.
She just went, oh, sorry, like, look, I saw it online, and obviously I got worried, so I shared it in the locum group. And I was like, where did you see it online? She said, oh, this locum rates or locum pay or something like that. I was like, fair enough. I was like, look, we are a service. I spoke to her and she was like, yeah, look, I'm sorry. I thought I was sharing it just to kind of help prevent someone from getting scammed. I didn't realize you guys were a legit company. And then all
Yeah.
these people that are requesting refunds, then saying to them that, look, you signed up for a reason. We're still offering that same service. Don't be spooked by what you're hearing. You can call the hotels that we booked these venues. You can see our trainer online has made the GP that we've recruited has made a video.
Right.
I've done these Instagram lives where you're kind of answering questions, and it's weird because you're sitting there trying to talk to about 4 people, and you're
We've
like,
done them. Yeah, they
you're like,
are.
oh, any questions, guys? And there's 4 people watching, but none of them asking questions. And out of those 4 people, I know one of them is my wife downstairs. Anyway, um,
And her cousin and her sister.
yeah, exactly. It's like, oh, guys, try and share this
But
if you
that's a
can.
big thing. Right now that you're saying that, like we people and a lot of us repost, but unless we know the
Yeah.
facts of it, like it's so big, we should be looking at the facts and the underlining before just reposting it, the underlining kind of facts or concept, where it's come from. Is it true, is it not? Because so much nowadays on social media is just reposting, and then
And fake
these
news.
kind of fake news comes out, and that's how it gets traction, and then we believe it, etc. So it's a big thing. So hats off to you guys, and hats off to you guys to see a gap in the market and then take the leap and do this. Like a lot of people that when they heard about Pharmacy First, it was more of a point, oh no, pharmacists again being told to do more work for less and doing so much more. It was a bit like the next thing after MURs, which didn't do so well from what I know, as in I'm in hospital, but from what I know. And then now it's Pharmacy First, and people just thought, oh, it's another thing that we're being told to do. But you guys, again, in adversity, what people thought you saw an opportunity, that's such a big thing, like in these kind of business minded people, and that's how they see an opportunity and propel with it. So so hats off to you guys to do that. And what's the biggest problems you see at the moment within Pharmacy First and your kind of the trajectory that you guys are going in?
The thing is that I think the whole plan was, I think you were supposed to get signed off by March or April when you did the Pharmacy First training. So the NHS had this thing set up for the pharmacies to kind of go, right, here's a setup payment that we're going to incentivize you guys to get on the Pharmacy First. You sign yourself off as competent, you get all the equipment in. Once you've done that, we'll give you this payment for doing all that once you've signed yourself off. So there was a big rush to get it all done before kind of March, April time. So we were like, right, we're going to do everything in February. So we had 4 dates in February. We were like, right, every weekend, just smash them out. And then still Monday to Friday, go to work, right? So it's like, right, just Saturdays are my only day to kind of chill out. But on Saturdays, you're just getting ready for the Sunday. Now, I think Pharmacy First in general has been as in Yaz might know better than I do, because I've been working in community pharmacy for about 7-8 months. But it's a great service. It has reduced the burden on GPs massively in terms of your UTIs and stuff, in terms of infected insect bites, in terms of the more common things. Yeah, but at the same time, the PGDs that were released weren't great. The clinical pathways, they left a lot open to interpretation, right? And the restrictions on some of these things were like, say, for example, the otitis media one, right? The one that we're covering, with the ear examinations. If there was no, if you could see in a person's ear that there was an infection, like there's, yellow pus, the tympanic membrane or the eardrum is bulging, there's clearly pus behind it, we still can't do anything unless that's a perforated eardrum. So under the PGD released by NHS England for that pharmacy first, you're like, right, I can see it's infected, but the PGD won't let me treat this. So this, you need to go to the doctors. And there's different restrictions within these PGDs that it would allow pharmacists to kind of take a bit more ownership of that consultation. But at the same time, I don't know a lot of pharmacists that probably would want to take ownership and make that clinical decision. So I think there's good sides to it in terms of the fact that it will help patients get access to these things a lot easier. It will help primary care in terms of reducing the burden. It helps pharmacies because they get paid to do it. There's another source of income, and how much you promote it and how much you push it will only generate more income for your pharmacy, along with obviously more appointment times and stuff like that, or more clinical time spent with patients. So how much you push it. I know some pharmacies that just so heavily kind of involved with pharmacy first that they've recruited second pharmacists to be there on the day just to do the pharmacy first consultations. Yeah. So it's definitely obviously working well. And I think in Scotland they have pharmacy first, but they have like 21 conditions.
Yeah,
Whereas we've only just started. Yeah, so I think the model of it is probably going to follow Scotland, where actually this pharmacy first that's been launched is only like in its 1.0 right now. Pharmacy first 2.0 will probably have a few more. Pharmacy first 3.0 will probably have a few more. Things that are very basic, don't need massive clinical input or massive clinical decisions that they can just set up. So obviously, at the moment, our pharmacy first training after February just kind of came to a halt. We were like, right, we've seen as many people as we could, we've helped as many people as we could. There's probably not going to be a big need for it. But now we've got one more session set up in 3 weeks' time or 4 weeks' time, just for like the new pharmacists and people that might have maybe missed that wave back in February and March. And I think we're the only ones in London doing it, to be honest. But yeah, I think there's pros and cons to the pharmacy first service. Pro being it is what you make of it, and cons being it is what you make of it. Like generally, the more you put into it, the more you're going to get out of it. But if you don't want to engage in it, you're not going to get anything out of it.
It's happening, so got to make the most of it.
Exactly.
Oh, I think that's really interesting though, and it's great that you guys did find that opportunity to kind of train all these people and support them as well throughout this journey, and it's really sad about that post, but I think it's really good that you guys, the way to overcome things like that is by doing reels, all that, so content creation to show that you are real and
But this is it. It's
you're out there.
It's like 2 weeks before our first event, right? We've got nothing to show that we're a real company other than saying, look, these venues are paid for, this trainer's paid for. What more can I give you, right? I'm doing these Instagram bloody lives to kind of put my face at it. Go, there's a real person here, right? Like, this is my driving license. Other than just short of going, look, Other than no, I didn't really put
Oh.
I didn't put my driving license, but
No,
other
but
than just kind of going, these are my bank account details in case you think I'm scanning you. There's nothing else that I can kind of promote. And then after that first event, so the first event we had 4 sessions, 25 people in each session, so a small group,
that's
so we
amazing.
can give them as much attention as we need. Sold out, right? And then we had like loads of pictures, loads of things. So initially we only had 3 sessions set up. Then we start getting loads of kind of people signing up for the other 2 sessions in Kent and Cambridge. Once they saw that we're real in the Hertfordshire day, when we're uploading these things onto Instagram, onto Facebook. And then we set up a 4th day in Stratford, and that sold out as well. So it's
Boom.
like, yeah, once they saw that actually we're real, once they saw the feedback we were getting, like I set up QR codes so that the people that are coming could give us feedback on things that were good, things that weren't so good. And generally, I think every single session had like 9.5 out of 10 as overall score. And it was
Amazing.
brilliant. Yeah. And the feedback you get, the negative things were like, oh, no breakfast on the day. Like I'm offering you training, not breakfast, man. Like,
Food. People want to
And
be fed and watered.
I
yeah,
know.
that's it. It's like, oh, no lunch offered, no sandwiches. What are you talking about? So yeah.
But no, that is
Wow.
amazing though. And do you know what? I do think there's a huge need for this because it's not only just for pharmacy first, all these pharmacists want to be supported clinically because once you've finished your prescribing, once you've finished, there's a lot of pre-reg supporting companies out there, but there is no like post-grad supporting companies out there. So I think you've definitely like got something there. And, even if you just did, because you've got the GP there, even if you just expanded it to auscultation or different things that, people might want to know about just to be more comfortable being a prescriber. But we take so much of your time, Abid. Thank you so much. But we always ask, what is it, 2 things, Gin, at the end of each podcast recording? Oh,
The first one, which is, what's the worst piece of advice you have received? And if you've kind of taken it and molded it into a good piece of something now in your whole life.
The worst piece of advice.
Yeah.
yeah. That probably like stuck with you where you're like, there is no
Yeah.
way I would ever kind of keep, be what that person told me I was going to be, or,
I think, nah, to be fair, I don't think, I think the worst piece of advice or the worst, rather than advice, the ethos, right? The worst ethos I've seen in people is in some of the kind of managers in Boots, where their objective working and how they're working is to deliver targets, regardless of how their staff feel or how the staff are, right? I've looked at it, I've been in that situation where it's not a question of who you are, what you're doing, it's a question of what you're delivering. And going forward, I say to the guys that I work with now, I'm not accountable to the people that are above me. I'm accountable to you guys. I make sure you guys are okay. And if you guys are okay and you feel supported and you're comfortable, then everything that these guys want will come. But if I'm just trying to achieve targets, if I'm achieving targets by basically sacrificing you guys and your time and your well-being, then all I'm going to do is basically just lose your support and you'll eventually leave, or you'll stop doing what you're supposed to do, and you'll just get disenfranchised, basically, which is what happened with me and Boots, unfortunately.
yeah.
I loved my team there. I loved the patients. The company itself, I just got massively disenfranchised with. So I think I used the opposite of what I saw there. And I actually speak to people here. I take into account what they want, what they need, and trying to incorporate their feelings, their opinions in their work, rather than just going, this is what I'm doing, this is what you're going to be doing now. You've got no say on it. Take it, this is yours, go do it. Don't ask, don't question. So that's probably the worst thing in terms of my professional life, what I've seen and what I've experienced.
That's
So
really
good for
interesting.
changing. Yeah. And
Yeah.
like adapting of how you want leadership to look like, and
Exactly.
yeah, and that's the main thing out of it. So yeah, adapting to those things. But yeah.
And then the last bit was, what are the 3 things that you could advise our listeners if they wanted to follow a similar career trajectory to you or land a role that you're in at the moment?
So, first bit of advice: if you could have asked me these before, so I could have had it practice. Not just off the top of the dome.
Sorry, I totally forgot.
First bit of advice, I'd say go for it. Like, if you see a job position, if you see something that you might be interested in, something that interests you, apply for it, go for it. Because if you don't apply for it, you're not going to get it. If you apply for it, even if you don't get it, at least there's a chance you might get it, right? Like, I know it's going to sound corny, but you got to be in it to win it. If you don't apply for a position, if you don't put your name in the hat, there's no chance you're going to win. Whereas at least if you put your name in the hat, there's a chance that they might just be impressed with you, or you might just have a very good day and actually get the job on the day of the interview. And as not just as pharmacists, but as people, sometimes we tend to think, I'm not good enough for that role. I'm not good enough for that position. The only one way to find out: apply for it, get it, do the job. And you'll find out when you're in the job that actually, I can do this job. I can do this role. So yeah, go for it. Don't get in your head about whether you can or can't do something. Get into the job first, and then find out afterwards if you can do it or not. Obviously, don't go for something clinical where you're like, surgeon as a pharmacist, and you get into surgery and you go, shit, I can't actually do this. But obviously, all within means. Secondly, as much of a hypocrite as I sound in saying this, make sure you maintain a good, healthy work-life balance. Try and remember what you're working for, and don't let working get in the way of actually what you're doing it for. Right? If you're working for your family, make sure you're not sacrificing family time for work. And third is just constantly learn. Never stop learning. Just always, as soon as when you see, we talked about the fake news, Instagram, the nonsense that you see people promoting online. Yes, you should be drinking water. No, you shouldn't be drinking water. Fruit is good for you. Fruit is bad for you. Only eat meat. Wake the F up, guys. All that nonsense that you see online. Research it. Anytime my mom sends me videos made by these Indian guys or this doctor in America about how this is good for you, that's good for you. First thing I do is I research it. Research everything they send to you. And that way, when you're in clinic and someone says, oh, I saw this or I saw that, you've actually got the data to kind of go, actually, no, this is not that, or this is not that. Or you've got data to say, actually, yeah, this would be better for you, or that would be better for you. Right? Constantly learn, constantly try and develop. Never just think to yourself, I'm comfortable where I am. I'm happy where I am. I think I know everything I need to know. You're just going to you're going to have inertia. It's going to be difficult to start kind of learning all over again. So constantly be learning. And I think I've rambled on long enough.
That's pretty nitty-gritty.
Yeah, this has been amazing. Thank you so much. Sorry, we've literally taken a very, very long time of your time, Abid.
No, it's all right. It's all right.
Thank you so much. It's been absolutely amazing to get an insight into your roles, all these kind of like transferable, non-transferable skills that you've developed over the years. And, I know our listeners will just have so much to get from this podcast. So really, really, really thank you. And one last thing, if anyone wants to get in contact with you, A, can they? And B, what's the best place, like LinkedIn or?
I think I am on LinkedIn.
Instagram.
Yeah, I think now that I'm addicted to Instagram, it's probably
it. Yeah.
I've got LinkedIn, but I'm not particularly active on it. Like, I know I log in every few weeks and I've got 50 invites from different people wanting to connect. And initially I was like, why are these people trying to connect with me? Reject, reject, reject. And then I learned that actually LinkedIn is a place that you connect with people. It's just like, okay, now I just accept everyone.
Yeah.
But I'm not particularly active on LinkedIn. So if you want to reach out to me, Instagram is probably the best way. I think abidafinawala, I think there's only one of us on Instagram.
Amazing.
Otherwise, yeah, you got the Pharmacy First training account as well, so you can always message through there. But yeah, if anyone has any questions or anything, then by all means, I'm always open to helping someone out.
Amazing. Thank you so much. And thank you for your time today.
And
Wow,
thank you,
we've had
guys.
a
Yeah,
good
thank
time.
you so much. It's been an incredible conversation.
Yeah.
Good.
See you later.
Cool. Bye.
Thank you very much.
Bye.
Have a good day, guys.
Bye.
You too.